coming in. But I did want to try to get this underway. As all of you, I hope, know, our school and the university have a great interest in experiencing diversity. And that is in all of its various forms. Homogeneity is something that tends to result in death of the organism. It's an incestuous relationship. We can only communicate with those that are like you. In a lot of different ways. We do. So with that in mind, we here at the school have a great opportunity to work with Dr. Colin Davis, who is the Assistant Vice Chancellor of the University of Health Sciences, who works with all of the health science schools and who helps coordinate a number of efforts such as this. Beyond that, we're going to have the privilege today to have Kim McGrew from the DIA in her role to address the efforts that are going on and the kinds of things that happen from us. So I would at this point like to introduce Dr. Davis, and we will take it to the next level.
Thank you, Dr. Ron. Good afternoon, everyone. Good afternoon. Much better. Much more robust. So welcome. Glad that you are all here today. It is my pleasure to introduce you to someone whom I have known and admired for quite some time, Kim McGrew. Kim runs Access, Diversity, and Inclusion efforts for DIA. Prior to that, she worked with diversity initiatives like Robert Wood Johnson. But I first came to know her when she ran the Dennis Diversity Pipeline at Columbia University. A long-standing, well-funded, and very, very successful initiative that an awful lot of underrepresented students into and through dental education. She's been a long time, not just an advocate, but a champion for diversity and inclusion in dental education. It is my pleasure to bring her to speak with you today. Please join me in welcoming.
Good afternoon. Can you hear me okay? Yes. So it's my pleasure to join you today. I cannot tell you how much of a red carpet that I've had rolled out for me today. I had a guided tour by future Dr. Braxton Henderson. That was amazing. I was met with some wonderful students from the hygiene school here this morning for breakfast. I had a wonderful meeting with Ruth Dean, other esteemed faculty and staff. So really, I can say that Pitt does it with quality. That's my first observation. Before I start my talk, I just wanted to get a sense for who's in the room. How many School of Dental Medicine folks are here? Okay, that's a great majority. Any other health professions represented? Okay, so it's the home team. Okay, so I'm a public health person by training, and so I'm going to first take out my red scarf and say women across the country are dying of heart disease. It's the #1 killer of women. Today is Go Red Day, and I see a couple of red sweaters out there, and I'll say Go Red to that. So I'm going to try to do a couple of things this morning, this afternoon. I just want to kind of steep us in the topic of oral health disparities across the U.S., a topic that many of you are very familiar with. I'd like to talk a little bit about the ways that we can increase access to the dental profession for historically marginalized groups. And finally, I'm going to talk a little bit about how we move towards a culture of inclusion. So this is going to be like a mini Jeopardy. I'm going to have you try to fill in the blanks for some of these. Some of these are tough, but are there any DBS MPH students here? So maybe I'll call on that one person in the first. 100, as many as 130 million What do you think that number might refer to? Any brave souls? Uninsured? Yes. People who don't have dental benefits. So it's about 3 times as many as medical benefits. So there's a big problem in terms of need and access out there. 49 million. Any guesses? Those are dental profession shortage areas. So many folks in rural areas are included in dental shortage areas. 1 in 4 children. Louder?
Don't receive dental care?
Right. Have untreated dental tooth decay. Now the most common chronic illness in school-aged children. 19 million children have no dental insurance, more than twice the number who don't have health insurance. And finally, low-income families and racial and ethnic minorities tend to be disproportionately represented in those who are underserved. So we know that we have a very fluid and changing healthcare environment. The Affordable Care Act is providing care to millions of Americans who traditionally did not have access to health care. The current estimate, and remember I'm from Washington, so current estimates are only as good as probably the next 5 minutes, but current estimates are that 8 million more children will have access to dental benefits via the ACA. And that'll be important for you as future providers because we want to, at least at ADEA, want to send the message that it is the profession's responsibility to try to meet that need. I'll talk a little bit about dental education's role. I think dental education does have a role, but I think it's the profession's responsibility overall. So a little bit about workforce. We hear this all the time. Our nation's changing demographic composition is really going to change the way that we have to meet needs. It's going to change who's in the higher ed system, it's going to change who's in the patient population, and it's going to change who is in our dental schools. Underrepresentation of minority groups within the oral workforce continues to be a persistent challenge, and the need for healthcare professionals who are both culturally competent and able to provide quality care is paramount. I put this up here because I wanted to let you know that dental education, the safety net that's provided by your clinics at our 66 dental schools is indeed contributing to the access issue, is helping out with the access issue. Dental students, folks in this room, have provided $3 million in 3 million dental visits in 2010 and 2011. More about what a diverse workforce does. It contributes to trust within communities. It contributes to better patient satisfaction, and in fact, more research and minority-specific healthcare inquiries. So, as we've talked about, both in medicine and in dentistry, the oral health workforce has failed to keep track with a growing racial and ethnic population. The workforce is inadequately prepared to address health disparities, and to the extent that we are able to introduce more cultural competency, more behavioral sciences, more public health in the curriculum, it improves our ability to treat more patients. So I wanted to give you a little bit of trend data, what's happening in terms of our applicants and enrollees in dental education. You can see back in 2000 we were around 7,700 applicants to dental school. We had a steady increase up until 2007 where we had a max of about 13,000, a peak of about 13,000. And since that time we have plateaued at about 12,000. It always kills me to see that last trend, because I'm saying, do dental students know? It's like, how do they know 12,000 is just the magic number for applications to dental school? So that's what our application picture has looked like over time. Now let's talk about enrollees. I might have to come on this side. So I want to draw your attention, folks over here. I'm sorry if I'm in your way. So 12,000 applicants, we wanted to see what that looks like in terms of race and ethnicity as we try to seek ways to recruit a more diverse student body. For Black African Americans, we've had some increases, again, 2007 peak year, and then we've just been around the 600 to 700 range since that time. We've actually seen an uptick in one group of underrepresented, historically underrepresented folks, and that has been in the Hispanic Latino category. American Indian, Alaskan Native has been very small, and Hawaiian and Pacific Islanders even smaller still. So we're at about 1,600 applicants out of 12,000. So that's about 13%. Now if we look at enrollees, so we enroll about 5,500 students. We've seen over time that's increased. Who knows why? Big reason? More dental schools. So since 2000, there were about 55 dental schools. This year, as of 2013, there are 66 U.S. dental schools. Okay, and if we look at enrollees, very, very flat in terms of Black African Americans, slight uptick in Hispanic Latinos, and again, very small numbers of American Indian and Native Hawaiian students. Last slide is kind of giving you some context. Our dental schools have about, at least in terms of responses to our comprehensive faculty salary survey, about 10,000 faculty were represented. We can see the numbers of our historically underrepresented groups, 300 Black or African American, 600 Hispanic Latino, 21 Native Hawaiian and Pacific Islanders, and that's at about 10%. Okay, so there's a challenge here, right? There's a big gap in what we see as our applicants and what we see as our historically underrepresented groups. And so I had some very rich conversations at breakfast, and as I walked the halls of your school, and actually as I talked to some of your administrators about ways to generate interest in young students in the dental profession. I heard things like, you know, you need to start really young. You really need to talk to high school students. You need to talk to health advisors to give them exposure. You need to provide more job shadowing opportunities. And I wanted to give you a sense of what the literature says about dentistry and when and how students get interested. Back in 2004, I was part of a group that did a focus group of students, African American, Latino, Native American students at campuses across the country. And resounding thing that we heard across all groups was early frequent exposure to dental profession was essential, was not optional, for students to consider a career in the dental profession. So there's no sexy TV show about dentistry, right? It's always pain and suffering and, you know, the butt of jokes, right? So, you know, how different would our world be if we had, you know, sexy doc and fees on TV, right? Or if folks said, you know what, as opposed to, you know, call, I'm going home at the end of the day. And I'm not saying that, you know, certainly our private practitioners work really hard to keep their businesses open, but there are some lifestyle considerations that may be of interest to a broader range of students. So this is kind of one of the tough nuts to crack, and I would definitely be interested at the end of the talk in hearing your thoughts about ways to engage students at younger ages and to get them first thinking about this as a viable profession and then the academic preparation that's necessary to pursue that. So I'll tell you a couple of things about what ADIA is doing to kind of address this, to increase access. The first I'll talk about is the SMDP program. Anybody heard of SMDP or been an SMDP alum? Okay, a couple over here. It's a collaboration between the American Dental Education Association and AAMC, our sister or brother medical association. I'll talk a little bit about the pre-doctoral accreditation workshops that we have planned. As of July of 2013, there are revised pre-doctoral accreditation standards that all schools must adhere to. And they include new language about climate, about diversity, about culture. And we're trying to assist schools in giving them more tools to kind of meet those standards. And then I'll talk a little bit about some work we're doing in admissions. No. Okay. SMDEP is a free 6-week academic enrichment program that offers learning skills, clinical exposure, career development, the all-important financial aid planning, and health policy. Students are enrolled in summer programs at 12 schools across the country every year. 3 of them are medicine only, but 9 are medical dental partnerships. They are all over the country. So if you have a cousin, nephew, somebody in your family, somebody in, a great place to have SMDP literature would be, give kids a smile. I'm sure that, we'll make that available for the next event. But it is a free program. There's a competitive application process, but we really are looking to engage students in the early years. So it's for rising sophomores and rising juniors in college. So a little bit about what we've seen. So SMDEP is a spinoff of MMEP, which was a medical-only program. So the dental, the D, was added back in 2006. So let's see who's been in the program since we started. So we have almost 50-50, slightly more men than women have enrolled in the program. Pre-dent scholars have been overwhelmingly women, which in some ways is not surprising. We've seen, the trend in women applicants to dental school going up for some time now. And matriculants, they're about the same numbers. Now let's look at our historically underrepresented groups. They represent 5.3% of total applicants, 4% of enrollees. Pre-dent scholars, they're about 34% of the pre-dent scholars, and 27% are matriculants. Now I should say matriculants to dental school, so we've had a very good yield from dental school. The number is not as high as you might think immediately because they're young. So it's of the students who were eligible to apply, right? So if they started in 2006, they weren't even eligible to apply to dental school, so the earliest might be in 2009. Okay, so that's a little bit about the program. So I had one big factoid I wanted to throw out. Did you know that 12,800 underrepresented minority students graduate every year with a bachelor's degree in the biological sciences? Average GPA 3.0. So my question is, where are those students in our applicant pool? We're getting 1,700 applicants. And so I take that fact on the road as I'm visiting our campuses to say, let's partner together to think about ways to attract that pool. And some of the discussion that we may have afterwards may be about early interest in some of these students. It could be that some of these students are, shall we say, swayable. If they just knew that dentistry was an option, they might consider it. Okay, so I'm going to shift a little bit to talk about the pre-doctoral accreditation standards. And for this, I actually want to read the language that is included in the standard so that you get a sense for what. So the pre-doctoral, I need glasses for this. Okay. All right, font's too small. All right, diversity, this is a way to, the background to the standard reads. Diversity in education is essential for academic excellence. A significant amount of learning occurs through informal interactions among individuals. So some of the homogeneity issue that Dean Blum was talking about, from individuals who are different races, ethnicities, religions, and backgrounds, come from cities, rural areas, from various geographic regions, and have a wide variety of interests, talents, and perspectives. These interactions allow students to directly and indirectly learn from their differences and to stimulate one another to re-examine even their most deeply held assumptions about themselves and their world. Cultural competence cannot be effectively acquired in a relatively homogeneous environment. Programs must create an environment that ensures an in-depth exchange of ideas and beliefs across gender, racial, ethnic, cultural, and socioeconomic lines. And I want to say that ADIA really tried to work very carefully with the review committee that worked on the new language. We're really happy that the committee considered a lot of what we were recommending. So shorthand, dental schools must, these are must statements, achieve appropriate levels of diversity among students, faculty, and staff. They must engage in ongoing systematic and focused efforts to attract and retain students, faculty, and staff from diverse backgrounds. And they must systematically evaluate comprehensive strategies to improve the institutional climate. Okay, so let's do some definitions. Before we go any further, I probably should have done this at the beginning. Definition for culture. When you think of culture, how would you define it? Yes?
Oh, wait, I actually have a question.
Oh, yeah, please. Question and then culture.
How do you define, or how do you determine what are appropriate levels of diversity?
Yeah, that's a great question. Yeah, our dean. No. I think the school has to look very carefully at its mission, right? Where it's located. It is all the complexity, right, of the environment that we live in. So for Pittsburgh, it's going to mean something different from West Virginia. That's going to mean something from, USC, right? They will all be different. And it really takes a lot of very intentional reflection and intentional metrics and monitoring and saying, look, who are we trying to recruit? Who are we trying to educate, and who are we trying to graduate? To what end, right? To treat our local group. I worked for 15 years at an academic medical center in Brooklyn, New York. And it was our charge and mission to recruit students from our state, and to the extent possible from Brooklyn, right? If we could grow a pool of students who were, from the area, we were doing right by our state's mission as a state school. And so I think it's the charge of each school to sort of figure that out. Culture. Anybody brave enough to tackle culture? What do you think about when you think about culture? I'll call on somebody. I only know one person in the room. Teacher Dr. Henderson, how do you think of culture?
I guess, it's kind of hard, but it could be, someone in their way of life, which, could be wisdom, views on life.
Yeah, you're exactly right. Core beliefs, traditions, those things that are, we generally think of as attributes that are very personal, right? How about climate? Oh,
I think of climate as the tone of the environment where you live and work. And it can be warm, it can be friendly, it can be positive. Depending upon the behaviors of the individual in the environment.
so I think exactly right. So culture is kind of, it's sort of core beliefs, individual. Climate is kind of how those things play themselves out through interaction, right? So, and usually climate is the measurable thing. You can't sort of measure somebody's culture exactly, but climate is something that you can say, okay, chilly, warm, chilly, warm. So climate is, that's how we kind of distinguish those. And inclusion. Anybody want to tackle inclusion? So inclusion is a nurturing, respectful environment that promotes success of everyone broadly. I mean, that's the way I like to think of inclusion. It has to engage everyone, it has to include respect for everyone, and it has to include equal access to success for everyone. So those are going to be our working definitions as we continue the conversation. Okay, so back to the accreditation standards. So dental schools should include, now these are should statements distinct from must statements, should develop strategies to address the dimensions of diversity, including structure, curriculum, and institutional climate. Dental schools should articulate its expectations regarding diversity across the academic community. And I'm going to skip to the end. And dental schools should establish focused, significant, and sustained programs to recruit and retain suitably diverse individuals, faculty, and staff. So that went into effect of July 2013, and our schools are still trying to figure out how they are going to engage in ongoing systematic review of their policies and practices. And ADEA is trying to create a variety of mechanisms, including a set of regional accreditation workshops to help them through that. We're now developing some content on climate and really want to help them use some tools, some ways to assess and measure climate. Please.
Is there certain, goal or percentage that the schools are supposed to reach? Is there a deadline they're supposed to reach about?
Well, accreditation happens once every 7 years. I don't know where you guys are in your 2017. So preparation for accreditation is probably happening now, but at least probably a year out. But really giving schools some time to really think through mission, policies, and practices, and then how to monitor all of those things.
Okay. So as far as the one that is, improving faculty diversity and things like that, how does the school know that they've met that standard according to CODA?
CODA is looking for documentation that you have plans in place. Yes, it's looking for outcomes, but equally important is the means that you are seeking to achieve that, and that you're looking at it periodically. We tried this. We tried doing different things with our search committee. Here's what it yielded: 7 more applicants from diverse backgrounds, racial and ethnic diverse backgrounds. Our goal is twice as many. What are we going to do to tweak it? So it's that kind of thing. It doesn't have rigid, and it allows for really schools, again, to examine where they live, right? It might not be the same in every environment. Okay, so this is just more about the 3 specific areas that CODA talks about, and that really is in the academic literature: structure, which is, the difference in the room, the difference in the faces, the multiple identities that are present. Curriculum is usually thought of as classroom diversity, how you talk about difference, how you talk about patients from different backgrounds, how you bring your best self and your background to conversations in the classroom. And climate are those sort of interactional things, how it feels. So very quickly, I'll just say that one way to really influence the climate and the culture of a school is to have some impact on who's coming in the door, right? The selective admissions process. I know you guys are you're at varying levels, but you probably can remember painfully the application process to dental school, right? Or to hygiene school or other allied fields. And really, it's that work. It's how do you figure out how to present yourself on paper, right? With just metrics in a way that an admissions committee will say, you know, I see something in him or her. And equally difficult are the admissions committees trying to take, you know, huge numbers of applicants, pare that down to, you know, a small few that you'll invite for interviews, and then figure out who are the students that will be successful in the school, what are we looking for in terms of classroom, teaching and learning contributions. So it's a tough job. It's a tough job for students applying. It's a tough job for admissions committee. So some things that we like to say is that when you have a class that is more diverse, students are able to think more critically and deeply, solve problems better, and they're more motivated to participate. So we advocate for admissions practices that are mission-driven, which I've talked about 30,000 times, that give a balanced consideration of students' experiences, attributes, and metrics that are grounded in the evidence, and they consider how students will contribute. So, okay, so this is one of my little favorite cartoons. It's about, so it says, in the interest of cultural diversity, we've hired Jason here, who owns a number of hip-hop CDs, right? So, one of the challenges with diversity is, what are we talking about, right? Are we talking about race, ethnicity? Are we talking about gender? Are we talking about gender identity? Are we talking about religion? Are we talking about ability? What are we talking about? It's very complex, right? So the tendency is to try to just do something, right? Jason with the hip-hop CDs, right? Or food, fun, and festivals, as we like to say, right? Taco Tuesdays, you know, Black History Month, we're going to have, you know, somebody speak. And those are fine, those are great. You know, we love celebrating our culture and our heritage. But if that is all that our schools do, that our health professions campuses do, what a missed opportunity, right? What a missed opportunity to hear from, you know, a Latino student and their journey and how they got to dental school and all of the things that their culture brings to those conversations. So we advocate for more than food, fun, and festivals. So I have one of my most fun YouTube clip. I'm going to try to get to yeah.
Hi.
Nice day, huh?
Yeah, finally, right?
Where are you from? Your English is perfect.
San Diego. You speak English there.
Where are you from?
Well, I was born in Orange County, but I never actually lived there.
I mean before that.
Before I was born.
Well, where are your people from?
Well, my great-grandma was from Seoul.
Korean. I knew it. I was like, she's either Japanese or Korean. So I was leaning more towards Korean.
Amazing.
Shashin. There's a really good teriyaki barbecue place in my park. I actually really like kimchi.
Cool. What about you? Where are you from?
San Francisco.
But where are you from?
Oh,
Really? You're Native American?
no, regular American. Oh, well, I guess my grandparents are from England.
Oh, well. I think your people's fish and chips are amazing. Weird? Must be a Korean thing.
Awesome. One of my favorites. So, I mean, how many times have we, you know, run across those really kind of gaping stereotypes about groups? You know, you're trying to figure out what to say, and like, okay, trying not to say something inappropriate or whatever. I mean, we all do it, whether as egregiously as that gentleman there, sort of make some assumptions. And what we're hoping is that as our climates evolve, that that difference will be okay, and people will be able to talk about it and say, you know what, my bad, I made a really bad assumption about you, and would love to know more about you, right? About you, right? Full range of your experiences. Are there any comments on that? Bring up anything, please? Okay, so we're going to talk just for a minute before I close on inclusive climates. And the higher ed literature is really robust in talking about climate and how students can be fully satisfied, engaged, and successful in the higher ed space. Sylvia Hurtado, who's really one of the lead researchers on institutional climate, talks about the interplay between the historical nature of the university. So let's say you are in a place, a school that was in the segregated South, right? What kind of historical legacy might you have to overcome in terms of climate? The structural elements of climate, psychological, behavioral. So what we're hoping is that our regional accreditation workshops will address all three. They'll talk a little bit about structure, and when we talk about structure, we're talking about school policies, their metrics, how promotion happens, hiring practices, historical policies, how they were created, what's the aegis? Does anybody ask, why do we have a policy for this? Human capital, the composition of the students, faculty and staff, also professional development opportunities. So, this is my wrap-up. I would say that if there's any take-home that I want you to get from the talk, is that dental education can and should be actively engaged in addressing workforce disparities. There is a lot of work to be done. 130 million Americans without dental insurance. The Affordable Care Act will only give access to 8 million. Our dental safety net, 3 million. Those are drops in the bucket compared to the need out there. And we feel at least at ADIA in our work, that making the health professions more diverse can contribute. It's not a cure-all, but it's a way to engage. So I would encourage all of you to engage, and to engage me now in a dialogue, questions, discussion, help, suggestions. We would love to engage you in a partnership in really talking to students, young people, about dentistry as a wonderful career option. So thank you.
For scope people, Marcia, put up your hand, and of course Dr. Vieira and Dr. Bodger, if they're willing to, can also sign your sheets, and I'm here too. There are a lot of people today.
Hold on 1 second.
I'm sorry. Be sure you write down very carefully what the assignment is. Right, you have another one? Oh, okay.
I'll email you.
Right, because everybody's
You get all the forms and stuff.
Please.
I'll send you my phone number and stuff so you can text me.